Hi, everyone, and welcome to our discussion of the Eisenberg Family Depression Center 2.0 Resources to Accelerate Your Research. I'm joined here today by my colleagues Victoria from the Mobile Technologies Core, myself from the Research Innovation Core, and Karen, Connie from Membership Engagement and Events, Stephanie from Outreach and Education, and Megan from Data and Design. So a little bit about the Eisenberg Family Depression Center. We are the nation's first center. We were established over 20 years ago as the country's first center dedicated to the study of mood disorders. And over the years, a number of other academic centers have popped up across the country to also study, depression and other mood disorders, but we were a trendsetter in that regard over two decades ago. Our membership is a diverse group of experts from across University of Michigan whose work has the power to revolutionize the way we understand, treat, and prevent depression. We have over 200 members from 33 departments across campus. Who is the new Eisenberg Family Depression Center? So in the 1.0 version of the center, our first 2 decades were focused on raising awareness of the prevalence of mood disorders and reducing stigma associated with living with mood disorders. In the 2.0 version, in our next chapter, overall, we have a greater emphasis on the uses of data and technology to innovate advances in mood disorder research. So we are university-wide, since interdisciplinary approaches to mood disorder research is more likely to elucidate new and innovative findings. We are a financially independent unit within the medical school. We are no longer a part of the Department of Psychiatry. We are membership-based and prioritize members for our research services, which we'll talk about in more depth in a few minutes. We are a collaborative community, and as we grow, we aim to create opportunities for networking and research collaboration. We have a robust set of research cores, which offer a variety of research services to support faculty with their work. We have an incredible and impactful outreach and education team. And we have a rich informational website with a host of resources to which faculty may refer. We have a broad and ambitious vision and mission. Our vision is to eliminate the burden of depression and bipolar disorders. And our mission is to improve lives and empower communities through bold innovations and interdisciplinary collaborations across research and outreach that advance the way we understand, treat, and prevent depressive illnesses. So why do we take an interdisciplinary approach? So there are quite a number of statistics here on this slide, and there are 2 main takeaways that I want you to know about this. The first is that there is a strong interplay between an individual's risk for a depressive condition and chronic conditions. So obviously the body is one unit. There's the mind-body connection. We're all sort of one organism. And so it makes sense that our brains and our bodies are constantly talking to one another and interplaying off of each other. So if someone is dealing with a chronic condition such as diabetes, heart disease, or stroke, they have a higher risk of developing depression or other mood disorders. Likewise, if someone is dealing with a depressive illness, they are at higher risk for developing a chronic condition. In the physical realm. So it makes sense that there are a number of people that maybe are very focused in their particular line of research in their field. You may not be aware of the prevalence of all of the mood disorders, including depression. So on the slide, you'll see that there are a number of statistics that really highlight how prevalent, these disorders are. So more than 50% of Americans will be diagnosed with a mental health disorder at some point in their lifetime. So this is not an insignificant, condition that really impacts a lot of other physical illnesses. So many researchers are discovering that the disease states that they research are impacted greatly by mental health. Therefore, you may have opportunities to intersect and collaborate with many researchers who may not have traditionally been seen as mental health researchers. So the EFDC is really the convening point for all kinds of faculty studying all kinds of different disease states, including mental health, but also including other physical illnesses. So you may find that there may be some other researchers in the EFDC who might be a surprise in terms of their departmental affiliation or research focus. But building collaborations and identifying co-investigators with broader reach will support multifactorial solutions to the complex topics of depression, bipolar, and mood disorders. So the take-home point here is that every discipline and every researcher has something important to offer. And with that, I'm going to turn it over to my colleague, Victoria.
Thank you, Karen. So our center is working to shift the paradigm of how depression and related illnesses are understood and treated. The EFDC is home to 3 new core units that provide a supportive and highly collaborative environment for U of M researchers and a thriving outreach program that brings solutions into the community. Our goal is to ignite bold new ideas, explore new methods, and utilize cutting-edge tools to move mental health research forward. The Research Innovation Core catalyzes groundbreaking research programs and interdisciplinary collaborations through events, programs, funding, and personalized faculty support. The Data and Design Core accelerates the research process by leveraging existing data resources and provides hands-on team support. The Mobile Technologies Core supports the entire research team to reduce barriers associated with using mobile technologies in their research through capacity building affinity groups and customized guidance. Our outreach and education program engages with communities and provides a continuum of mental health programming aimed at raising awareness, reducing stigma, and promoting help seeking among special populations. This is the big picture view of the support we provide. And this graphic helps researchers visualize the research process and how that research process aligns with key study milestones and contract and regulatory process, along with the support offered by the EFDC. The 4 key stages of the research process are at the top in the blue boxes. And as you follow the blue bars down the page, you'll see insight into the activities and resources within that research stage. Items that are a slightly brighter or darker yellow indicate areas that may need additional considerations for studies utilizing mobile technologies. And study teams can browse our website where you'll find quick forms for specific services, or you can email depressioncenter@umich.edu and we will route you to the appropriate person or persons. It's not uncommon for investigators to be working with more than one core at a time because, as you will soon see, we all support research in our own unique ways. So collectively, we provide funding, opportunities, engaging programs, supportive services, curated resources, collaborative events, and community outreach and education. We'll now walk you through the resources and services we offer to help you advance your research. Let's get into the details, and I'm going to turn it back over to Karen.
Thank you, Victoria. So one of the things that we're really proud to offer through the Eisenberg Family Depression Center are funding opportunities. So our internal funding program used to be called the Center Awards. We have rebranded them as the Impact Grants. We believe that this seed funding will have the opportunity to provide a really positive impact in the field of mental health research. And we seek to ignite the spark of your creativity, your imagination, to be able to come up with innovative ways to address the myriad complex problems of all kinds of mood disorders. And so with this new kind of revisioning of this program, we wanted to take a more streamlined approach. Rather than saying that we have a certain amount of funding and you have to fit your project to that amount of funding, we're asking you to provide your ideas for your project, and we will fit the funding to your project. So hopefully that really opens up the ability for you to be creative and really think about the best ways to approach research on mood disorders. We also have a two-part application, which we hope to reduce the burden on applicants. So the first part is to provide a letter of intent. This will be offered every year, going forward. And this year in 2023, the deadline for the letter of intent is May 15th. So this is a one-page application in which you share your idea, your abstract, essentially. You list your PI and your co-investigators and your bottom line amount of your budget that you're seeking to achieve for your project. From all of the people that submit their letters of intent, we will invite people to a full application and submit that by early July. So if you have more questions or are interested in more of the details around this funding program, please go to depressioncenter.org/impact, and that will have some more information, some more details about how to submit your application, and a list of frequently asked questions. And so with that, I will turn it over to my colleague, Megan.
Great, thank you. So I'm excited to share more about one of our newer programs that we offer as part of Depression Center 2.0, and that is the Research Incubator Program, which lives in our data and design core. The goal of the program is to link early career investigators with hands-on project support and resources so that they can generate impactful research in timely and efficient ways and have the necessary building blocks to launch robust and impactful research careers. To do so, we leverage existing population-based data sets and our team's support and expertise, which includes myself, as well as a PhD-trained lead statistician and 2 faculty experts. So how this program works is that participants propose a research idea or a question that they are interested in related to mental health that they may not have the capacity or the resources to answer themselves. If that research idea can be answered using existing data, then the research incubator allows our team to take that idea and do the hands-on work to see it through to completion. So we call this the project heavy lifting. We work with participants to help them refine their research question, identify a data source and the relevant variables, develop a project plan, and pre-register that plan using open science, clean the data, lead statistical analysis, and then collaborate with participants to interpret the findings and disseminate the results. The program uses a cohort model with 3 to 4 participants enrolled in the program at a time. It involves individual meetings and group meetings with the other cohort participants, and typically involves a few hours of work a week. And then projects are typically wrapped up within a year from the start of the program, sometimes less than that. And after the program, participants can expect to generate manuscripts, scientific abstracts, future grant submissions, among any other outcomes that are important to the participants. We also work with participants to equip them with specific tools and resources to assist them in the future based on their specific challenges and needs. Next slide. So if this program sounds like something that you would be interested in, the program follows the academic year calendar. So applications are typically due in the spring and the program starts in September. This program is particularly beneficial for people who have struggled to get their research ideas off of the ground due to limited capacity or resources. If you have limited experience with secondary data or limited statistical capacity, you don't have a research team, including any research staff, mentors, or collaborators, or if you're someone who's new to mental health research, the program has been really beneficial for those types of folks in the past. If that sounds like you, I would encourage you to apply in the future. You can always reach out with questions if you have them. And with that, we'll share more about the short-term services that we offer. So I'll pass it back to Karen.
Thank you, Megan. So again, in the Research Innovation Core, we're extremely proud to be able to offer support in writing and editing and other types of consultation for grant proposals and publication in academic journals. So Eric Simon is our senior technical writer at the Eisenberg Family Depression Center, And he will provide all kinds of different services to faculty who are doing research in mental health, including offering tailored searches for any particular type of funding that the team is looking for. He sends out a monthly funding opportunity announcement via email that's also updated to our webpage so that anyone who's looking for any particular grant opportunity can see ones that are current and ones that are anticipated to be coming up in the future. He also updates a call for papers announcement that goes out again on email and is updated to the webpage for high impact journals that might be looking for articles. And then he also takes a look at the impact factor listing for various journals and encourages faculty to identify the best fit for their needs to identify the best journal to publish in. He provides editing support on like pretty much all sections of the grant proposal and the article, and he does really incredible work. So if you have not had a chance to meet with Eric, he is available to meet with individual researchers, teams. He specializes in also working with early career faculty to really help to identify the best options for grants and papers and journals. And then he also is incredibly skilled at working with multidisciplinary and multi-site teams. So even if it's a really big project, he is a really strong person to have on your team to be able to make it all fit together. And with that, I will pass it back over to Megan.
Thank you. So we also offer consultation as part of our data and design core for people who need more short-term help with data and design related questions that we can answer in a quick phone call or a few back and forth emails. So specifically, if you're someone who needs help finding an appropriate data source, if you have data access questions, survey design questions, or need help finding appropriate mental health measures for your study, if you have a statistical question or issue that's coming up in your analysis, or you're just not sure where to get started with your project, if there's anything that you want us to look over, we are happy to support you. You can submit a request via our website or just reach out to us directly via the email address that we'll share at the end, and we'll be happy to help you. So with that, I'll pass it to Victoria.
Thank you. So within the mobile technologies core, the most frequent question I'm asked is, why is the Depression Center taking on this role? And Karen's comments about interdisciplinary approaches covered this far more eloquently than I will. But my simple answer is that we believe all research with human subjects would benefit from including a mental health assessment. So we support any study utilizing mobile technologies within Michigan Medicine and the university. And if you're unsure of which mental health measure would be meaningful for your study, we'll refer you to Megan, who has much more experience with mental health measures than I do. The consultation intake on the mobile technologies page serves as the access point for resources across campus. We're actively developing tools and resources that simplify selecting technology and guide study teams through the entire study cycle. We are also working on formalizing the relationship among our partners in the mobile study ecosystem shown in the graphic to more seamlessly support the U of M research community. We hope to have more details about this soon. In addition to providing direct support to study teams, we're also tackling building the infrastructure that will increase accessibility for all researchers interested in utilizing mobile technologies. The infrastructure that we're working towards will reduce costs, decrease the amount of technical expertise needed by study teams, and make mobile data easier to analyze. We are literally learning new things every week. So whether you reach out with what seems like a simple question or for a consultation, I promise I'll provide you with a ridiculous amount of study-specific information and resources that will aid your decision-making and support your study objectives. The Mobile Technology Core also co-facilitates 3 affinity groups that together boost the skills and expertise of the entire study team. DigitMI meets from October to May. At each meeting, we feature a presentation on a topic related to digital and mobile technologies and the opportunity to collaborate among members. MDEN is where the folks in the study that are hands-on with the data meet. We share challenges and crowdsource resources to support studies from a data perspective. And we now have a GitHub repository for studies to share code used in cleaning and analyzing mobile data that we are excited to begin populating. The MCN is for study coordinators who support mobile study. We're working on building libraries of sample language for regulatory processes, grant applications, and study protocols. We're also working to identify and share best practices. Both MDEN and MCN have Slack channels that enable members to chat with each other and provides access to the files shared by group members. While each group has an independent purpose, the work often transcends one particular group. I'd like to provide a quick example on how the affinity groups work together to leverage the expertise within each group for the good of the whole. As you may know, there are well over 20 different vendor products in use at U of M providing study, survey, or data management solutions. We're in the process of evaluating these products for use in mobile studies. MDEN and MCN both help identify the criteria that we would use to evaluate them. Then members of all affinity groups were invited to complete a survey based on the criteria to help us prioritize features currently being used, desired features for the future, and to identify areas where more education could benefit the community. We're now scheduling demos for these vendors and inviting all affinity group members to learn with us. Our next coordinator meeting will have a speaker to address one of the identified education topics, and several speakers have been identified for our next season's DigitMI presentations due to their expertise in areas where we could stand to learn more. The Depression Center membership is not required for membership in any of the affinity groups. So anyone interested in building their skills for utilizing mobile technologies in human subject research is welcome to join. And I'm going to pass it back to Megan.
Thank you. So the last thing that I will mention about the data and design core are the data set resources that we have compiled on our website. So earlier I mentioned that our team seeks to connect people to sources of secondary data. And there's many reasons why we think that is so valuable, mainly because there is a wealth of existing data that includes rich information on mental health. And these are typically available online, mostly for free, often with very large sample sizes. Many are nationally representative or longitudinal in design. So they are really valuable for all researchers, particularly early career investigators, because the data collection has already been done, obviously, so that greatly speeds up the research process. And it allows you to test hypotheses and make research advancements more quickly and efficiently for much lower cost. But if you've never worked with secondary data before, it can be difficult to know where to get started. So we have developed this catalog of resources to help you with that. So you can browse our collection of data sets that we've curated because we think they are really useful for mental health research. They are organized by subtopics. You can browse by the topic of your research question, like physical health comorbidities, mental health comorbidities, aging, stress, substance use. There's many topics available. You can also browse by data collection type, mental health measure, and study design as well. There's also a search function if you are looking for something more specific. So we have about 15 data sets on there right now. We will continue to add more as we work with them in the future. But I think this is a great resource if you're just starting to dip your toe into the secondary data world and want to see what's available. So with that, I will pass it on to Connie. Sorry, Stephanie.
Thank you, Megan. Yeah, so I'm actually next. So the University of Michigan as a whole institution has really established itself with the vision of being a health promoting university. So with all this cutting edge research that EFDC members are engaging in and us propping up these new research opportunities, we're really in a unique position to reduce the time from bench to bedside to really make an impact on mental health on a large scale. So how do we do this? So we are really rooted in a public health behavior change model approach. And we engage with communities to identify opportunities where we can intervene and provide a continuum of mental health programming, really aimed at raising awareness, reducing stigma, and promoting help seeking, because we know that earlier intervention leads to better outcomes. So we have a number of different populations that we work with. Our college student mental health, every year in March, we host the Depression on College Campuses Conference, where we bring researchers in from all over the nation to present sort of the latest research and also interventions on college student mental health. And our Campus Mindworks program is really directed towards college students, originally sort of inspired by students who were coming into college already diagnosed with a mental health condition, and how do they navigate that and really support their mental health while they're in college. And we also have a lot of information on specific populations within college students, because we know it's a very diverse campus. And so we do a lot of storytelling to help reduce stigma as well. Our Athletes Connected program, we work with college student athletes because we know that they don't seek help for a variety of special reasons. And we also have student veteran programs that is a national program as well, where we support different campuses across the nation with supporting student veterans. And then we also do a lot of work with our local community, as well as communities throughout Michigan and the nation. Our peer-to-peer depression awareness program, we use this public health approach, and we actually teach students about public health programming, and they are able to create their own campaign really unique to the needs of their specific school. And we teach them about safe and effective messaging and really support them in doing that work because we know that peers are more likely to listen to each other. And then we also have teacher trainings. We have workplace training. So we do a lot of work with what does mental health look like in the workplace? How can supervisors and peers really recognize when somebody might be struggling and support their either folks they supervise in getting additional help. And then really for this group too, we do a lot of service and consultation. So we do community education, we provide some mini grants, we do screening days, and then we have just a lot of people who approach us and say, hey, we have identified this need in our community, and can you work with us to sort of figure out the best way to intervene. So if you have work where you're really trying to connect with the community, I would love to connect with you and sort of get your research out to the community, but also connect you with the community. So again, we can sort of advance these research into the community and help as many people as we can. So I'm going to hand it off to Connie now.
Thank you, Stephanie. So today I just want to talk to you a little bit about some of the events that we have coming up here at the Eisenberg Family Depression Center. So our center is committed to eliminate the burden of depression and bipolar disorders. So I just wanted to highlight a couple of annual events. My colleague Stephanie mentioned both of these events, but I just wanted to give a little bit more detail about the actual dates and registration process. So our annual mental health conference will take place on August 16th. And this is a half-day virtual program designed to bring together key stakeholders to discuss strategies to improve employee mental health. Registration will be or is available on our website. And then, as Stephanie mentioned, our Depression on College Campuses Conference is our annual event that brings together hundreds of researchers, clinicians, and health education specialists. This amazing event is planned for March, and we'll have more information on this on our website as well. So it's our pleasure to share with the community the latest discoveries, news, and events focused on depression and bipolar disorders. Please visit our website for the most up-to-date news and information. Next slide, please. So my colleagues talked about the great opportunities we offer to our community of researchers. And I have the great pleasure to work with many of our current members, as well as get the opportunity to meet with prospective members. And I have highlighted just a few benefits here to being an EFDC member. We welcome you to join our community of University of Michigan researchers. And if you have the desire to just find out more information about becoming a member, I definitely encourage you to reach out, email me, and I'm happy to schedule time on Zoom. Next slide, please. So I've listed here just some information about our contact information. So please feel free to reach out to any of us at any time. Our general inquiries website is monitored regularly. So again, like I just encourage you to reach out and we'll, I feel like, can we stop the recording?
Just start from the beginning on the slide and they can edit that bit out.
Oh my gosh, thank you. We welcome you to reach out to any member of our team at any time. Our contact information is listed on this slide. Our general inquiries email account is regularly monitored and inquiries are routed to the appropriate person in a timely manner. Thank you for taking the time to view our presentation and we look forward to hearing from you soon.